Thanks for joining us today. Welcome to the Center for States video series on the essential functions for monitoring, evaluating, and applying findings. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Monitoring, Evaluating, and Applying Findings brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to plan for and execute strategies to monitor and evaluate implementation efforts and interventions, strategies to collect and analyze data for a variety of evaluation types, and then using data to make decisions and plan for sustainability of programs where feasible. It does this by providing step-by-step guidance to strategize and develop a plan for evaluation, collect and analyze data and consider fidelity and costs, and then use results to make decisions about ongoing efforts and sustainability. The Monitoring, Evaluating, and Applying Findings brief is broken down into 4 parts and 11 essential functions or tasks. It is important to remember that while the steps are presented in a linear way, in practice, often these steps will overlap and be revisited as teams continue to monitor, evaluate, and apply their findings over time. Part 1 is setting the stage and includes considering the circumstances and needs of the agency, developing a logic model, identifying questions, and identifying the data measures, sources, and collection methods that will answer them, and then developing an evaluation plan. Part 2 is collect and analyze data, and it includes strategies to put the evaluation plan into place by collecting and analyzing the data outlined, and then 2 special featured topics that are a version of data collection and analysis. They are examining fidelity and analyzing costs. Part 3 outlines how to use the data collected to make decisions and adjustments, with 2 functions on sharing findings and recommendations, and then the topic of this module, which is making decisions to further spread, adjust, or discontinue. Then Part 4 is on sustainability planning and how teams should refine and implement a plan to sustain interventions when this is the decision of the team and stakeholder groups. Let's get started. Why do teams need to make decisions about further spreading, adjusting, or discontinuing the intervention? Teams use monitoring and evaluation findings to continue to learn about the implementation and its effectiveness, and this decision point will help teams to identify if an intervention is effective enough to continue to spread it further, to identify whether there are challenges or barriers in the agency's implementation of the intervention that can be adjusted to improve the intervention effectiveness, and to get team consensus on discontinuing when the intervention has produced negative effects, has not resulted in the desired outcomes, or is simply unsustainable within the agency's context. How do teams make decisions to further spread, adjust, or discontinue? At key points in the monitoring and evaluation processes, teams should reflect on the findings with stakeholders. They should bring stakeholders with various perspectives together to review the findings. Discuss the implications as a group. Do the findings suggest that there are adjustments needed, or does effectiveness suggest that it could be further spread? And identify next steps as a group. What needs to happen to either spread, adjust, or discontinue the effort? These are valuable opportunities to reflect on what the data reveal about what has worked, what hasn't, what it means, and lessons learned for moving forward. Teams can use formative evaluation findings to determine next steps and further develop their intervention. Anytime the team discovers the intervention is causing harm to children, youth, or families, they should stop implementation. More commonly, data may point to areas for adjustment in implementation processes or to the intervention. When adjusting an intervention, teams should continue to be mindful of maintaining the integrity of the intervention model and its core components, and they should make these decisions as a team based on agency capacity and needs. Before modifying intervention components, teams should examine whether failure to achieve outcomes was caused by poor or incomplete implementation processes or poor fidelity to the program model, and they should determine as a team if there is agency capacity to make any changes. Teams can also use formative evaluation findings to decide if and when the intervention may be ready to move to summative evaluation. Moving ahead after a formative evaluation, teams should revisit plans and processes for continuing to collect and analyze, process data, and track progress. Let's take a look at how formative evaluation findings might shape the team's decisions and next steps. If formative evaluation findings show the initial results indicate harm for children, youth, and families, teams should stop implementing the intervention. If formative evaluation findings show the intervention fidelity or integrity is weak, and the intervention does not appear to result in expected outputs or short-term outcomes, then the teams should make improvements to the fidelity, the target population's exposure to the intervention, the quality of service delivery and receptiveness to the intervention, and/or the intervention components where needed. If formative evaluation findings show the intervention fidelity or integrity is high, but the intervention does not appear to result in expected outputs and short-term outcomes, teams should assess limitations in the evaluation and conduct further analysis as appropriate, or revisit problem exploration and intervention selection, or make adaptations to the intervention if the findings suggest this is needed and there is agency capacity to do it, or stop implementing. Lastly, if formative evaluation findings show the intervention fidelity or integrity is high, and the intervention results in expected outputs and short-term outcomes are trending in the expected direction, teams should proceed to summative evaluation. If summative evaluation findings show successful implementation and effectiveness in the desired outcomes for the target population, then teams may want to continue and perhaps even spread the intervention to new areas. Let's take a look at other ways summative evaluation findings may shape the team's decisions and next steps. If summative evaluation results show the intervention was implemented as designed and there is strong evidence of effectiveness, teams should proceed with further replication and spread the intervention, and continue to conduct formative and summative evaluation regularly. If summative evaluation results show that the intervention was implemented as designed and long-term outcomes were not affected, teams should assess any limitations in their evaluation and conduct further analysis as appropriate, or return back to problem exploration for further analysis, modify the intervention based on data, or discontinue the intervention. If summative evaluation results show the intervention was not implemented as designed and long-term outcomes were not achieved, then teams should adapt the intervention to improve fidelity to the design or discontinue the intervention altogether. Lastly, if summative evaluation results show short-term, intermediate, or long-term outcomes indicate harm for youth, children, or families, teams should stop implementing. When making decisions about whether to sustain and/or expand an intervention, teams should consider not only evaluation findings, but also readiness. Capacity considerations might reflect leadership. Is there ongoing leadership support for the intervention? Program champions. Are there visible stakeholders that advocate and garner ongoing support? Culture and climate. Does the organizational culture foster its success? Does the external environment, for example, the broader child welfare system, state legislation, or policies, promote sustaining the intervention? How does workforce morale affect implementation? Resource availability. Is there sufficient funding and staff to support continuation or expansion? Knowledge and skills. Have intervention-specific knowledge and skills been institutionalized to carry on those practices? Supportive structures. Can implementation supports, such as training, coaching, fidelity monitoring, and data systems, be sustained to build capacity for ongoing implementation and improvements? Will contracts with service providers need modifications? And relationships and networks. Have key stakeholders been adequately engaged in the process? Are partnerships with external systems and community organizations that contribute to service delivery intact? Motivation issues relate to whether agency staff see the intervention as a priority, consider it compatible with their values and practices, perceive it as advantageous to other alternatives, and find it manageable to implement. Teams should consider key questions when making decisions about whether to further spread, adjust, or discontinue an intervention. What are the implications of monitoring and evaluation findings for next steps? Has the intervention been fully implemented as intended? Is there evidence of effectiveness? Is there evidence of progress towards short-term, intermediate outcomes, or long-term outcomes? Have there been any unintended side effects or harm? Is the intervention sustainable? If the intervention was successful and is sustainable, should it be expanded? Should the intervention be adapted? Would it be more effective to address needs in a different way? Answering these questions together as a team can help to make decisions about the next steps for an intervention and whether to spread, adjust, or discontinue it. Let's take a moment to check in on what you've learned about making decisions to further spread, adjust, or discontinue the intervention. Why do teams make decisions about spreading, adjusting, or discontinuing? To identify as a team if an intervention is effective enough to spread, if it needs adjustment to improve, or get consensus on discontinuing when appropriate. How do teams make decisions about spreading, adjusting, or discontinuing? By reflecting on findings with stakeholders and making collaborative decisions about next steps after formative or summative evaluation, considering the data, agency readiness, and ongoing capacity or motivation. What can help teams make decisions about spreading, adjusting, or discontinuing? By considering as a team the implications of findings, fidelity, evidence of effectiveness and progress towards outcomes, any unintended side effects or harm, and the potential or need for intervention sustainability. Now take this a step further by reviewing the reflection questions for make decisions to further spread, adjust, or discontinue the intervention in your monitoring, evaluating, and applying findings workbook to connect what you've learned to your own experience. Up next is refine and implement a sustainability plan, the 12th module in this series and the 11th essential function in monitoring, evaluating, and applying findings.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P2332014000033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.